The CCP was founded in 1967, 55 years back, by 12 members. I wish to announce to you the passing away of a founder member of the CCP, Professor Channa Vijayasinghe, in Australia yesterday. May we, at the very outset, observe a minute of silence in memory of this great person, knowing that his blessings are with us at this ceremony. Thank you, ladies and gentlemen. I stood before you on the 25th of January this year at the presidential induction ceremony without an inkling of what catastrophe would engulf the country just a few weeks later. We as a nation in recent times withstood 2 youth insurrections, the tsunami, the Easter Sunday carnage, the COVID pandemic, and the 30-year civil war. We are a nation of resilient people and came out of all these battered and bruised, but ready to fight another day. But the last 8 months, many of you would agree, have been the most difficult period in our memories. Every single one among us was badly affected. Spending hours or at times days in fuel queues, or being unable to join a queue sufficiently early due to hospital work, not having cooking gas at home to prepare a hurried meal for the children before we rushed off to find that elusive transport to get to hospital, having to stockpile food, worrying about an impending food shortage, playing our roles in political resistance movements, asking that politicians who ruined the country be held accountable, struggling with 8 to 10 hour power interruptions on a daily basis. A period where everything about tomorrow was uncertain. It is difficult to imagine worse times. Traditionally, the CCP Council meeting is held on the second Friday of every month. But it was changed to Thursday as Friday became the day all of us had to join fuel queues for health workers. With rising anger of people who resented preferential treatment for health workers, our lives were at risk in these queues. In these chaotic and dire circumstances, most organizations fell into disarray and fell apart. What of the CCP over the past 8 months? I'm certain many of you are familiar with the music of Billy Ocean, the Trinidad-born British rhythm and blues singer. He did the theme song for the film Jewel in the Nile and sang, "When the going gets tough, the tough get going." Well, he didn't say it like that. He said something like, "When the going gets tough, the tough get going." Yes. When the going got tough, the CCP got going. We started with the traditional CCP academic activities, which have earned many accolades for us over the years. For every month, the CCP has a specialty theme. We had 8 college lectures, 8 specialty updates with participation of experts from sister colleges. These provided excellent CPD opportunities, both for consultants and specialist trainees. Secondly, the Young Physicians Forum permitted specialist trainees to showcase their academic and presentation skills. We provided opportunities to 22 trainees at senior registrar level. The winner will receive the E.M. Vijayarama Prize this evening. Ladies and gentlemen, 17 years ago, I sat in the audience and walked up to the podium on an evening like this to receive the Vijayarama Prize. The memory of that moment still inspires me. I hope history will repeat and we will see the winners of today presiding over the CCP in the years to come. Thirdly, the training courses for the entry examination as well as the MD medicine examination were conducted. These included clinical short and long case training conducted in 12 centers covering all regions of the country. We have just completed the second cycle of the training, conducting it in 9 centers. In addition, in the midst of all these difficulties, the CCP set in motion a number of fresh initiatives. I shall briefly take you through them. Firstly, we added a novel item to the specialty updates, the quiz. The quiz, based on knowledge imparted in the specialty lectures, would be open to contestants for a few hours. And the winners were selected from those obtaining the highest marks within the shortest period of time. The winners were awarded prizes. We witnessed an unbridled enthusiasm to participate in this. Secondly, the Cutting Edge series had lectures delivered by overseas experts with international recognition. This created a platform for the speakers to share with us, the CCP, their thoughts about the latest developments in the management of medical conditions. We arranged 5 such lectures. Thirdly, the Peripheries to the Fore program provides a platform for physicians from hospitals in the distant provinces of Sri Lanka to showcase their excellent work in limited resource settings. The traditional learning model of academic organizations is centrifugal. We go from centrifugal. And then here we are shaking the model up and creating a centripetal form of learning where the center learns from the clinical lessons from the fine physicians involving serving rural masses. We had 8 such physicians delivering lectures to the CCP. Fourthly, the Pearls of Wisdom program travels in the opposite direction to the Cutting Edge and the Peripheries. We tap into the minds of our senior colleagues, often past presidents of the colleges, to learn from their enormous clinical and life experiences. We conducted 3 programs under this theme. Collegia Unitum Scientia is our 5th new initiative in Latin. In English, it means Colleges United in Science. This is the program where we reach beyond our traditional sister colleges and link with non-physician colleges. These help physicians to develop a more holistic approach to patient management. We conducted 4 such programs. 6th, Beyond Medicine is a program aimed at stimulating the right cerebral hemisphere of physicians. It takes physicians beyond the confines of medical academia, broaden horizons, give us happiness, and improves our lives. We had 3 such sessions ranging from Greek mythology to drama music to photojournalism. 7thly, the CCP Book Club is a reflection on the promotion of medical humanities. Members speak about a book which changed the way they practice or the way they see their life. At times, we invited celebrated authors for this. We conducted 6 such book club meetings. Bridging the gaps with non-medical professional organizations help to share our expertise with these professionals, in addition to creating a close relationship with them. The one program we had planned with the Bar Association of Sri Lanka extended to 4 programs at the request of their membership. The success of this was such that the Judicial Services Commission invited the CCP to conduct the Healthy Mind and Body program for the newly recruited judges undergoing initial training to serve in the judiciary. The Sri Lanka College of Psychiatrists was our partner in this program. Ninth, the CCP Communication Skills course conducted by a fellow of the college, Professor Raveen Hangwella, extending over 6 weeks, aims to bridge yet another gap in our quest for clinical excellence. 20 physicians are presently undergoing this training, including myself. Finally, Save Lives Sri Lanka is an ambitious project launched in collaboration with a number of other specialist colleges to raise funds from overseas well-wishers for supplying medicines which are in short supply, which has crippled our hospitals. When the country ran out of soluble insulin, it was the CCP's donation of 15,000 vials of soluble insulin to the Ministry of Health, which saved lives. When the kidney transplant patients had no tacrolimus, it was the CCP's collaborative effort with the Sri Lanka Medical Association of North America, which saved the day. Much remains to be done, and the CCP strikers are on the ball. How did the CCP manage all this while the country was in the direst of situations in an economic meltdown compounded by civil unrest? It is a philosophy we believed in. We believed in obstacles. We welcomed what stood in our way. We embraced impediments. The great Roman philosopher king Marcus Aurelius wrote in the Meditations, "What stands in the way becomes the way. The impediment to action advances action." In one word, ladies and gentlemen, it is resilience. Those who recall my address in January will remember that I listed resilience as the fourth attribute of a good doctor. Resilience means not merely surviving difficult times, but using these as a catalyst to become better than ever. The new initiatives carried out with success is ample proof that when the going gets tough, the CCP gets going. Turning to today's academic sessions itself. Our chief guest for the evening, Professor Nalin De Silva, Professor of Chemistry, and the foremost expert on nanotechnology in Sri Lanka. Why nanotechnology? You will notice that futuristic medicine is a thread that runs through the entire academic program lined for tomorrow and day after. The future of medicine is very likely to be personalized medicine delivered through nanotechnology and gene therapy. Our guest of honor is Sir Andrew Goddard, the immediate past president of the RCP. He is a dear friend of the CCP. Sir Andrew left office as president 2 weeks back after an immensely successful tenure. We are holding these academic sessions in collaboration with the RCP. The RCP has helped us to design the session on medical leadership and also arranged some speakers for the plenaries. The RCP has accredited this conference and attendees and provide 12 CPD points for the attendees and a further 8 CPD points for those participating in the medical leadership session. Over the last 2 days, we conducted 4 extremely successful, well-attended pre-Congress workshops titled How to Get Your Research Published, Supporting Underperforming Trainees, Experience Sharing Working Overseas, and Medical Leadership. We also conducted online presentation of research abstracts, both oral and posters. We had nearly 50 researchers presenting their work, and the best among them will receive prizes later this evening. The sessions will have 4 orations. The most prestigious CCP oration will be delivered later in the evening by Professor S.A.M. Kularatne, one of the finest medical researchers in the country. Doctors Rohita Amaravithana, Nilanka Pereira, and Inoshi Atukorala, who will deliver Professor K. Rajasurya, Dr. Cyril Fernando, and Dr. E.V. Piri's memorial orations are three of the finest from the next generation of medical researchers in Sri Lanka. I congratulate them all. There will be 7 plenary lectures delivered by thought leaders in medicine. Dr. Sarah Clark, the newly inducted president of the RCP, will deliver the opening plenary. This will be one of the earliest, if not the very first, international engagement of Dr. Clark. The Vice President Global of the RCP, Dr. Mumtaz Patel, another very dear friend of the CCP, will deliver the second plenary. The President of the Royal College of Physicians and Surgeons, Glasgow, Mr. Mike McCurdy, a surgeon, and the immediate past President of the RCPSG, Professor Jackie Taylor, will deliver plenary lectures. The CCP has traditionally been collaborating with the RCP and the RCP Edinburgh. In this instance, our warm hand of friendship has been accepted by the RCPS Glasgow, and we are expanding the CCP's global presence. Professor Sir Michael Marmot, the social determinants of health expert, who authored the book The Health Gap, will deliver a plenary lecture. One of the world's foremost authorities on genomic medicine or personalized medicine, Professor Sir Munir Pir Mohammed, will also deliver a plenary lecture. The 7th plenary will be from Professor Daniel Offrey, Professor of Clinical Medicine from the New York University and the editor of the prestigious medical humanities journal, the Bellevue Literary Review. The lecture will include a reading from her new book, When We Do Harm, a Doctor Confronts Medical Error. There will be 9 symposia covering the length and the breadth of clinical medicine. All will follow a similar format. The acute battle will cover the management of life-threatening conditions. The long war lecture covers a chronic condition where input from the specialist is needed for successful outcomes. The Frontiers to Conquer lecture provides a sneak preview of how medicine will evolve in the next 10 years within that specialty. We have speakers of the highest standing locally and internationally delivering these lectures. The 10th symposium will be on medical humanities and will include lectures on medical anthropology and poetry from Sri Lanka. Call the registrar. Call the registrar in capitals with 3 exclamation marks is aimed at our specialist trainees to enhance their knowledge and skills in managing medical emergencies. They are the battalion commanders in the wards when leading teams in emergencies. Occasionally, seasoned generals are also called upon to participate in these battles. So I invite my senior colleagues also, if possible, to join these sessions. The concluding segment of the academic proceedings will bring into focus the trials and tribulations we as a profession had to face and the most difficult questions we had to answer, the social and the political responsibility of the CCP. 2 eminent and eloquent past presidents of the CCP will present opposing perspectives in the session titled, Should the CCP Participate in Political Movements? Aragalaya, the Struggle and Beyond. Let's take this opportunity to open a discussion defining our socio-political role as the foremost professional medical specialist college in the country. Ladies and gentlemen, we have not made an academy program. We have painstakingly crafted a program that offers something for every member of the CCP to enhance their professional vistas. 2 months ago, having the annual academic sessions seemed a distant dream to all of us. When most colleges postponed, the 35 fine physicians in the council, as well as the wider membership, stayed resilient without losing hope. One story I had heard helped me to keep all around me going. The story about an Eastern king who wore a ring on which was inscribed the phrase, "This too will pass." All bad periods, like good periods, eventually pass. We need equanimity, patience, resilience, and creativity, and must never lose hope. We have done our best to live up to the theme for the year, bridging gaps and crossing divides. Conducting these beautifully crafted academic sessions with such elegance after all the turmoil in the earlier months is nothing short of a miracle. This is an academic feast replete with exquisite academic delicacies. As the greatest of all professors, the headmaster of Hogwarts School of Wizardry and Witchcraft, standing at the head table in the enchanted Great Hall, would have said, "Let the feast begin."